but the judges, the influence of the UK education, how the
science, technology, social development, the creative industries, entrepreneurship, public service, and many more. What unites them is not only their academic achievement, but their commitment to using what they have learned to make meaningful contributions at home. Their journeys are powerful reminders of how international education can inspire new ideas, open doors, and unlock opportunities far beyond the classrooms. Tens of thousands of Malaysians have graduated from UK institutions, and you now form part of an extraordinary global network of leaders, innovators, and change makers who are mentoring young people, building startups, and advancing research, shaping policies, as well as contributing to nation building in countless visible and invisible ways. And the British Council is really proud to accompany you on this journey. Through initiatives like the ALUMNI UK platform, we aim to help graduates stay connected.
Universities UK International, who are here as part of the UK higher education mission in Southeast Asia, Malaysia being the first and the best stop in that mission. Such a key strategic partner for the UK in higher education. That includes transnational education, and it includes the deep institutional collaboration that exists and which through this mission is growing and expanding further. It's a real part of the UK's commitment to support Malaysia be a regional education hub with its newly announced National Education Plan and the UK's equally fresh international education strategy. So tonight we are celebrating individual achievements, and these achievements really are remarkable. And it's an honour to be among such accomplished people who've pursued their education in the UK and are now making a real meaningful difference in Malaysia and beyond. But it's not only the individuals we're celebrating. We're also celebrating the flourishing people-to-people ties between our two countries, between the UK and Malaysia. And education is such a core part of that. Over the past decade, more than 80,000 Malaysians have been educated by UK universities. Over 12,000 choosing the UK every year. That is a real powerful testament to the strength of the bilateral relationship and to the appeal of UK education. So they're drawn by UK's global reputation for academic excellence, for critical thinking, and for innovation. UK education is grounded in intellectual rigor, is grounded in problem solving, and grounded in critical thinking. These are qualities which are essential to address the shared global challenges that we face today, from climate change to digital transformation, social inclusion and empowerment. So all you UK alumni here tonight should be proud of what you have gained from your education and be proud of what you are now giving back, because you are making contributions in business, in politics, in science, in public service, in civil society.
Three, 4, 5 candidates. Well done, congratulations.
I'm Ho Chi Beng. I'm an internal medicine physician and head of Department of Medicine from Kuala Hospital in Penang under Ministry of Health.
During the perhaps you can share some experience during the COVID time.
I think there's a lot of experience to share. One of the things is that I was very privileged during the COVID and that I get to assist my hospital director to actually transforming our hospital from non-COVID hospital to by stages to fully COVID hospital. Then we cared about 12,000 patients over the last 3 years. Because our hospital is pretty unique, we can actually change everything. We don't treat any other disease apart from COVID. So the whole Penang and the border of Perak and Kedah, they actually come to my hospital when they have COVID. We even, at that time, one of the miraculous things is that things that is impossible become possible. One of it is that our hospital is a district small hospital. We have 4 ICU only. During that time, it was really bad. People died, and actually we get the first hybrid or field ICU. ICU built by Army 10 and KKM. Within 2 weeks, we get to expand our ICU bed from 4 beds to 44 beds that actually accommodate a lot of people, patients. And the first collaboration between ourselves and also the army people, which is a very unique culture of collaborations. And the other thing is that one of the things that at that time I really see a lot of people who actually things become very outstandingly generous. I think people become very generous during the time. We even have nurses from private hospital, they were being borrowed to COVID hospital for the service. So basically we have not enough nurses, they actually come. And one of the amazing thing is that I can still remember, it was during the time, at the early phase of COVID, Malaysia do quite well until the time after the Sabah election. I think this is not going to be reported, but until the Sabah elections where things go bad, which is the Delta wave and so on. And one of the things that I find it very hard is that I see people die and I cannot do anything. We are seeing patients in their 20s or 30s die on the corridor. At that time, Malaysians were still they didn't believe in vaccine. Everyone just refused the vaccine because vaccine earlier rolled out, and there's a lot of refusals. And why do we have to take the mRNA vaccine? The moment when we see the mortality rate climb up and more young people just literally they just died. They are well, and because of the COVID so bad, they died. And we can see that after that, there's a rush of community to get the vaccine. Then things get better. And one more hard thing that I get to experience during the times that I get to see family die in the hospital. So for example, we have initially the husband they contracted the disease, they come in, they're very ill, and then later on the wife come in, and we have a few couples that they died side by side in the hospital. So from COVID, what I learned is that crises give rise to opportunities. So this crisis really actually turned everything around, the way we work, the way we think. In fact, I got the opportunity to do a lot of research. The research about treatment on COVID, for example, favipiravir and ivermectin. So those are very famous ones. And my hospital was the top recruiting hospital for the national study, that we managed to prove that those are useless. So apart from taking care of patients and also doing research, we also get to train more young people who actually young junior doctor during that time to actually teach them how to manage COVID. So I think it is quite rewarding, although it's not to say painful, but it's kind of fear of the unknown, fear of the uncertainty. But with what I learned from the UK education, because I think I did my Master of Science in Global Health and Infectious Disease back in 2012. It was not until 8 years later that I actually get to practice what I learned, even because I did online distance learning. I did not go to I did not do my physical course, but at that pre-COVID, anything online is very boring. Nobody will sign up for that. But my university and the UK education, they actually give us the opportunity to experience online distance learning. At that time, the course was well structured. So during the COVID time, we did effective communication is important to actually enhance the risk communication between different party and make things more transparent. So one of the things that we encounter is that transparency in communications, and also we have a lot of misinformation out during the time that which I get to learn how to mitigate with the knowledge I learned from the Edinburgh University. During the COVID time, it is that when because it is a public service, it's a public hospital. We cannot reject patient, and when patient become very ill, they will just keep coming in. The most challenging time is that I get to see patient lying at the corridor. They need oxygen, and we could not provide enough oxygen, and some of the patient actually move on because of that. I think this is the challenging time is that the preparedness for the pandemic is very resource dependent, but you need to get the resources in a short period of time, where else everyone is fighting for ventilator, fighting for oxygen concentrator, other country, other hospital. This is the biggest challenge to get the resources enough to actually to go for that pandemic preparedness. So now we actually revert back to normal. We have actually, in fact, we have upgraded, because before we become a COVID hospital, we only do COVID. Even though for pediatric, for children and pregnant women, we only take those COVID patients. We even put the COVID baby and mothers together. In fact, we also put the prisoner and their baby from refugee camp together. So this is one of the wonderful things my hospital setting, that we can do all these things which is impossible elsewhere. But now we revert back to normal. Everything has gone back to normal with a better resources. One of the good things that we are grateful, because from COVID time we have a lot of assets donated to us that we can benefit the current patient. So now we are seeing adult patient, children, pregnant women, and anyone who needs help. Actually, vaccine is the only prevention, or perhaps is one of the best preventions for any vaccine preventable disease, and COVID has proven it. As I mentioned earlier, that during the Delta wave, when there is nobody taking the vaccine, people just die. The youngest I saw die is about in the early 20s. He has no medical illness, so ill, and then just die. The moment when the people rushing for vaccine get better, it go to the Omicron phase, then the mortality rate drop a lot. So I think the facts speak by itself. Then of course we talk about vaccine side effect. In fact, many vaccine also they do have a small proportion of patient will experience certain side effects, and whenever this vaccine everyone take it, and during that time a lot of uncertainty, a lot of misinformation, of course, that information go around. Side effect they are some, but to the benefit and the risk, when you wait for that, we have to go for the benefit. If no, the world will never actually recover so fast from COVID. Talk about this Nipah virus, then you should go and talk. Nipah virus was discovered by our fellow Malaysian. It was discovered by Professor virologist from University Malaya, Professor Lam Saikin. Professor Lam and Nipah are now, actually all these viruses are on and off. When it go out, it will come back again. Nipah virus, the story is that in 1998, it actually started from pig farm in Malaysia, then it spread to Singapore, and then we stopped it by by killing the pigs. Then after that, since then, this virus somehow it actually go to India. Because it related to the fruit bats. Then because Indian people they like to take the fruits from the coconut. I can't remember. They call sap. So they drink the juices contaminated with the fruit bats feces. Then they actually got contracted virus. So now this is a recent emergence virus lah. So I mean like this is the same virus, but the transmission has spread across. But to this day, Nipah does not cause human to human transmission. If I'm not mistaken, I think I have to check.
And any final words from Dr. Kor about viruses and also the healthcare in Malaysia?
Yeah. So I think as a person from Ministry of Health, I think we are working harder, and also we are very optimistic for the Malaysian healthcare system to be better. Well, as we have learned from Malaysia, we have to be resilient. We have to accept, because Malaysia has the world best public health system, whereby from access and also access and expenditure side, we are doing pretty well. So it's just now that it's time that we have to take risks for transformation. Let's go on together, work together for transformation and empowerment. Right? And we have to empower ourselves, empower the system, empower the community, and empower the government to actually redesign a better healthcare system and deliver. So I think I follow ratio. But yeah, RA, resilient, acceptance, and also risk and empowerment.
One more time, and
That was good.